Mental Health and Reporting. Part 1. Kindness and Care. You may notice some of your students struggling to meet RSO deadlines, backing out of commitments, or generally appearing far less engaged than usual. Their behavior may leave you frustrated and confused, especially if they are not communicating with you effectively and their behavior is starting to impact the rest of the organization. These are not necessarily signs of laziness or lack of interest. Instead, students exhibiting these behaviors may be struggling with their mental health or with diagnosed or undiagnosed mental illnesses. Whether they're a grad student, undergraduate, first year, or senior, university life can be tough. This module provides insight on treating your students with empathy and understanding, as well as the information necessary to direct them towards on-campus resources. Major depression. Symptoms may include, but are not limited to, loss of interest or pleasure in hobbies or activities, persistent sad, anxious, or empty mood, decreased energy or fatigue, difficulty concentrating, remembering, or making decisions, short temper or easily frustrated, and changes in sleep patterns, insomnia or excess. Poor sleep hygiene can also lead to feelings of depression. It's important to remind students to get enough sleep. Anxiety. Symptoms may include, but are not limited to, difficulty concentrating, remembering, or making decisions, persistent nervous, stressed, or hyper mood, hyperactivity, movements, or nervous tics, difficulty with public speaking or communicating in general, decreased energy or fatigue, seeming frozen in action, unable to move forward with an activity or task, and excessive perfectionism. These are the most common mental illnesses for traditional college-age students. It is important to note that each individual's experience with mental health is different. Potential symptoms are not an all-encompassing checklist. Furthermore, mental illness may look slightly different in some of our older or non-traditional students, our students of color, our international students, or any of our students whose experiences are shaped by their social and cultural backgrounds. The most important step you can take as an advisor is to look out for your students and be wary of your presumptions and biases. For more information on mental health and mental illness, feel free to visit Syndicuse's website. Syndicuse also offers a list of topic-specific TED Talks. The Department of Student Affairs and Mental Health Outreach also offers free mental health first aid training to the Western community. To learn more, view upcoming trainings, and register, please visit the Office of Faculty Development's webpage. Checking in on students. What to say and how to say it. Oftentimes, we want to help our students and offer assistance, but we don't know how. We are unsure if we have the knowledge and resources to help, and we don't want to make things worse. A simple check-in is a great way to start the conversation, especially since it allows the student to decide how much information they would like to reveal to you. If you notice a student has been missing from several important RSO meetings, feel free to reach out with an email. Be sure to avoid accusatory language and focus on your concern for their well-being, not their absence. The following framing is a great start. I wanted to check in and see how you're doing. I've noticed you haven't been attending meetings lately. Is everything all right? If you take the time to come from a place of care, your student will recognize that and do their best to respond. Taking care with your language can also mean looking at yourself and the ways you communicate with your students. Do not use words like depression or anxiety lightly. These are words that refer to diagnosed illnesses our students may struggle with. If you are literally talking about a medical diagnosis, it is better to say a person with anxiety or a person with schizophrenia to emphasize the individual's personhood over their struggles. When you exhibit understanding through your attitudes and behaviors, your students will be more likely to approach you with a problem or concern. Part 2. Campus Resources. What's available to your students? The following resources are available to your students on campus. Please take note of a resource's confidentiality status before recommending it. Students will want to make sure that they know where sensitive and personal information is going. Also, please note that these resources may look different for the 2020 to 2021 academic year and beyond due to COVID-19. WMU Public Safety, Non-Confidential Emergency, reachable at 269-387-5555. Student Conduct, Non-Confidential, Conduct-Related, reachable at 268-387-2160. Counseling Services, Confidential, reachable at 269-387-2160. 1850. Syracuse Health Center, confidential, reachable at 269-387-3287. YWCA Advocate, sexual assault resource, confidential, reachable at kcarol@ywcakalamazoo.org. Off-campus resources are also available depending upon a student's needs, travel capacity, and/or insurance plan. Feel free to navigate to Syracuse's resources webpage for an extensive list of online, over-the-phone, and in-person options. You can also recommend various mindfulness apps and coping tools for students to download on their phones, should they be interested in managing their mental health needs outside of a professional setting. Please note that apps and other similar tools are supplemental. If a student is seeking professional treatment, apps are helpful, but not the ultimate solution. Part 3. Reporting. When should I step in? Before you begin the reporting process, you will need to learn how to recognize a student in distress. Below are some examples of signs that a student may be in distress. However, this list is not extensive. For a complete list, along with detailed instructions on how and when to make a referral, please visit the Student Affairs How to Recognize a Student in Distress webpage. Signs of distress. Repeated requests for special consideration, extensions, etc. Unusual or exaggerated emotional responses. Withdrawal from activities or friends. Significant change in sleep or eating patterns. Declining academic performance. Excessive absences, especially if attendance was previously consistent. Perfectionism, procrastination, and excessive worrying. Markedly changed patterns of interaction, for example, avoiding participation or dominating discussion. Always talk to your student first before reporting a concern. The following list from the Student Affairs website provides guidelines on how to approach a student who you think might be in distress. As previously mentioned, it is vital to come from a place of empathy and seeking understanding, not a place of frustration or accusation. Talk to the student in private when both of you have time. Give the student undivided attention. Express your concerns in behavioral terms. Share an observation. I've noticed you've been acting differently than you usually do, and I'm concerned. I statements are the best way to communicate concern. Avoid telling the student what they are doing and instead focus on what you have noticed. Listen in a non-judgmental, non-threatening way. Pay attention to body language. Are you leaning forward or away? Are your arms crossed or at your sides? What does your facial expression say? Communicate your understanding by repeating back the core of what the student has said. So here's what I'm hearing. Please let me know if this isn't accurate because I want to make sure I understand you. Avoid judging, evaluating, or criticizing. Respect the student's value system even if you disagree. After a detailed and lengthy conversation, or even several conversations, if you still feel as if reporting your concerns would be best for your student, the following processes and procedures are available to you. It is best to make a referral when your student does not respond appropriately when you express concern, or if erratic changes or behaviors continue to worsen. You may also make a referral if you are overwhelmed, unsure how to proceed, or would like to talk with someone about your observations and concerns. Please remember to avoid diagnosing your student and to remain cognizant of appropriate boundaries between you and your students. You can offer your assistant and a listening ear, but as an advisor, you cannot provide all the solutions. How do I report a concern? Reporting procedures. To refer a student concern, navigate to the Student Affairs Refer a Student Concern webpage, wmich.edu/studentaffairs/concern. There are options for reporting both academic and non-academic concerns. The webpage includes reporting instructions, follow-up instructions, and information on how to identify a student of concern. You will receive a confirmation notification from a Student Affairs staff member once the student has been contacted. Should a student accept assistance or share personal information with a staff member, university privacy regulations will be followed to determine any subsequent sharing of information. Immediate assistance. If a student is in need of immediate assistance, the following resources are available in the Kalamazoo area or over the phone. Please note that if a student is in imminent danger of harming themselves or a danger to someone else, the Syracuse Health Center recommends you go to the nearest emergency room or call 911. Borgess Medical Center ER, immediate psychiatric assessment and treatment, reachable at 269-226-4815. Located on 1521 Gull Road, Kalamazoo, Michigan, zip code 49048. Bronson Hospital ER, reachable at 269-341-6386. Located on 601 John Street, Kalamazoo, Michigan, zip code 49007. Griffin Place, a 24-hour help/crisis line for individuals of all ages. Dial 211 or 269-381-4357. Crisis Text Line, a 24-hour confidential number for anyone in any type of crisis. Provides access to free emotional support and information via text. Text START to 741-741. Michigan Voices for Sexual Assault Hotline for survivors of sexual assault seeking help and support. Text 866-283-1454. Steve Fund Crisis Line, 24/7 crisis text line for young persons of color who are feeling stressed, depressed, or anxious. Text STEVE to 741-741 to connect with a trained crisis counselor. As an advisor, it is important to respond with compassion to the complex issues your students may be facing, both within and outside Western. Be sure to match your actions with your intentions. It can be difficult to balance an individual student's needs with the needs of an RSO. Your support, combined with recommendations from the resources above, will help your students develop the skills and coping mechanisms they will need to engage holistically with the Western Michigan University community.